You have been diagnosed with Hashimoto's. You have been prescribed thyroid hormone medication. Or maybe you have been told your antibodies are elevated, but there's nothing to do until your thyroid stimulating hormone, TSH, drops. You have been exhausted for years. You have gained weight and you cannot explain it. Your hair is thinning. Your brain fog is getting worse. And every visit ends the same way. Your labs are stable. Stay on the medication. We will recheck things in 6 months. So this is not something I hear. This is something I diagnose quite often in my practice. Hashimoto's is a problem, especially among women. So nobody has asked why your immune system is actually attacking your thyroid gland. Nobody has investigated what exactly changed in your body to cause this. Nobody has offered a plan for anything except replacing the hormone your thyroid is losing the ability to make. What if the prescription is not just the only answer? What if the prescription is the consolation prize for a disease nobody is actually treating? I'm Stasha-Gae Roberts, nurse practitioner, U.S. Army veteran, BHRT certified, and the founder of Compassion Primary Care. You are not imagining this. You are not being difficult by asking for more. And you do not have to prove that you are struggling to be taken seriously here. So today I'm going to walk you through what Hashimoto's actually is, why the standard approach often misses the disease itself, and what a root cause evaluation and treatment plan actually look like. So let me name something specific. If your thyroid antibodies have been elevated for years and your primary care told you there is nothing to do until your TSH drops enough to justify a prescription, that is not correct. That is not the standard of integrative care. And it is not the standard of good conventional care either. That is just the standard of a 15-minute appointment where nobody has time to explain what elevated antibodies actually mean. Elevated antibodies mean your immune system is attacking your thyroid. Right now, today, at this very moment, every day it goes unaddressed, more thyroid tissue is actually being destroyed. Some of that damage can be permanent, some of it can be reversed. The gap between elevated antibodies and abnormal TSH is not empty space. It is the window where root cause treatment can actually change your disease trajectory. If someone told you to wait, they were not giving you care. They were giving you a follow up appointment. You deserve a plan for what to do with those antibodies now, not in 5 years when your TSH finally rises. So let me name what Hashimoto's actually is. So Hashimoto's thyroiditis is an autoimmune disease, and it's actually the most common autoimmune condition in the United States and the most common cause of hypothyroidism in women. Your immune system, which is designed to protect you from viruses and bacteria and other threats from outside your body, has begun identifying your own thyroid tissue as a threat. It produces antibodies against two proteins your thyroid needs to make hormone: TPO, or thyroid peroxidase, and TG, thyroglobulin. So, over years, this immune attack damages thyroid tissue and gradually reduces the amount of thyroid hormone your body can actually make. The diagnosis is made by measuring those antibodies. Elevated TPO or TG confirms autoimmune thyroid disease, often years before maybe a full decade before TSH ever becomes abnormal. Many women carry Hashimoto's quietly for an entire decade. So that's the fatigue, the weight gain, the brain fog, the hair loss, the constipation, all while being told their labs are normal because the labs that would have caught it were never ordered. Autoimmune disease does not happen randomly. The body does not suddenly decide to attack its own tissue without a reason. Research from Dr. Alessio Fasano at Harvard shows that three things must be present for autoimmune disease to actually develop. One, there must be a genetic predisposition. Two, an environmental trigger. And three, intestinal permeability, what we often call leaky gut. And all three must be present. So genetics loads the gun, if you will, and environment and the gut pull the trigger. This is the sentence that changes how Hashimoto's is treated. So, as we know, our genetics cannot be changed, but the environmental triggers can be identified and removed, and the gut can be healed. Address the gut and the triggers, and the autoimmune process can often be slowed, quieted, or in some cases, brought into remission, even when the genetic predisposition remains. That is the door root cause medicine opens. And this is a door prescription only thyroid management does not. So, again, Hashimoto's affects women far more than men, and the highest incidence is seen between the ages of 40 and 60. There are specific reasons for this. Estrogen and progesterone both influence immune function. So, as progesterone starts declining around the age of 35 and as estrogen goes through its roller coaster through perimenopause, the immune system loses some of the buffering that used to keep autoimmunity quiet. Many women see their first elevated antibodies in perimenopause or in the early postmenopausal years. Pregnancy and postpartum are also high risk windows. The immune system shifts dramatically during pregnancy and again after birth. Hashimoto's often surfaces or worsens during these transitions. And chronic stress is the third layer. Sustained cortisol elevation disrupts immune regulation and accelerates autoimmune processes. Many women can trace the onset of their Hashimoto's to a period of significant stress, illness, grief, or loss. If you are in your 40s or 50s and your antibodies are elevated, the timing is not a coincidence. The chemistry of this season is the contributing factor, and the chemistry can be addressed. So, here is what a complete Hashimoto's evaluation looks like: a complete thyroid panel, which includes things such as TSH, free T3, free T4, reverse T3, TPO antibodies, and thyroglobulin or TG antibodies. It's not just TSH. The full six markers must be done. Then the contributors. So, this is comprehensive gut testing that looks at inflammation, dysbiosis, and intestinal barrier function, nutrient status, including things such as vitamin D, selenium, iodine, zinc, iron. These are all commonly low in women with Hashimoto's and all necessary for thyroid function and immune regulation. Inflammatory markers such as high sensitivity CRP, cortisol rhythm, a hormonal panel, and a history that maps the timeline. When did your symptoms first begin? What was happening in your life at that point? Was it stress? Was there some kind of illness? Maybe pregnancy? Was there a dietary change? The events that may have triggered or worsened the autoimmune process. Most women with Hashimoto's have never been offered this level of evaluation, and that is where most of the answers lie. So the interventions that work require a layered support. Surprise, surprise. And the order matters. So I am always going to talk about diet, exercise, sleep, and stress management as the foundation, no matter what we're talking about. Targeted interventions come when the foundation is in place and the evaluation calls for them, not the other way around. Blood sugar stability supports both immune function as well as thyroid function. Again, healthy meals built around protein, healthy fats, and vegetables, and not the standard high carbohydrate American diet or breakfast that we're used to. Exercise or movement matters. Consistent, sustainable movement, not punishing exercise, which can spike cortisol and make autoimmunity actually worse. Sleep is essential. Poor sleep drives inflammation and disrupts immune regulation. It also disrupts cortisol. You cannot heal Hashimoto's while chronically underslept. Stress regulation supports the cortisol rhythm that everything else depends on. For Christian women, the practice of prayer and the rhythms of faith support nervous system regulation in ways that research is finally recognizing, but we knew that that would be the case. Then, gluten elimination. Gluten is the most studied trigger for thyroid autoimmunity. The protein structure of gliadin closely resembles thyroid tissue, so the antibodies your body makes against gliadin can attack your thyroid by mistake. A 2024 review in Nutrients confirmed that consistent gluten elimination reduces thyroid antibody levels in Hashimoto's patients. Many women see meaningful improvement within weeks to months of gluten elimination. Dairy elimination helps a meaningful subset of women as well. Gut healing based on what testing reveals. For most women with Hashimoto's, the gut has to be addressed, not with the generic protocol, but with targeted therapy based on the stool testing. That is what's actually going to help. Targeted nutrient repletion. Selenium supports T4 to T3 conversion and helps to reduce thyroid antibodies. Iodine is essential and often suboptimal, so proper repletion based on testing matters. Vitamin D actually supports immune regulation. Zinc, iron, and ferritin all matter significantly for thyroid function. Low dose naltrexone, often called an LDN, an older medication used at very low doses, actually helps to modulate the immune system rather than suppressing it. Research and clinical experience supports its use in Hashimoto's and several other autoimmune conditions. For many women with Hashimoto's, LDN reduces antibody levels, improves energy, and reduces inflammation. Hormone support where the evaluation warrants it. Restoring declining progesterone removes a major immune dysregulation factor. Again, I am BHRT certified, and this is one of the tools I use individually based on a real evaluation. And thyroid hormone. For many women, desiccated thyroid extract, brand names like Armor, NP Thyroid, or Nature work better than the synthetic T4 alone because it contains not only T4 but also T3. For others, synthetic T4 is appropriate. And then for others, a combination of synthetic T4 and T3 may be a preference. The right choice depends on the clinical picture, your preferences, and the lab pattern. The combination is what produces the change. So, why does this matter? Why do we care, right? Hashimoto's is progressive when left to its own devices. So, again, every month, every year, the autoimmune process continues. More thyroid tissue is being damaged. And some of that damage, again, is permanent. The conventional approach usually is to wait until enough of that damage has occurred over a lifetime before we put you on thyroid hormone replacement. Then you have to stay on that therapy. That is necessary once the damage is done, but it does not prevent further destruction. A woman diagnosed at 45 may be on the same prescription strategy until 75, with 3 decades of gradual thyroid loss along the way. The goal of root cause treatment is not only to manage your symptoms today, the goal is to slow or to stop the destruction so that as much functional thyroid tissue as possible is preserved for the future. Antibody levels can decline. I have seen it in my patients. The autoimmune attack can quiet. In some women, thyroid function actually partially recovers. And in all women, ongoing destruction is reduced. That is the goal worth pursuing. And that is the point of doing what I do. So here is what I want to leave you with. If you have been diagnosed with Hashimoto's and you have been told there is nothing to do but to wait, if your antibodies have been elevated for years while your prescription stayed the same, if you left an appointment with this diagnosis, please hear this. The prescription manages the symptoms. It does absolutely nothing about the disease itself. Your immune system is doing something, and you deserve a clinician who is willing to find out why. So, I am just going to talk briefly about one of my patients. So, I have a patient, she's now in her 60s, but it's been about 3 years now. And I remember I got her lab work, and her TSH, her thyroid stimulating hormone, was elevated. It was in the 6 range. Conventional medicine likes to say anything between 1 and 4 is normal. For me, I like optimal labs, so I prefer my TSH for my patients to be between 1 and 2. And so at that time, I was not routinely checking thyroid antibodies. I have since reformed and changed. And so I called her and said, we need additional blood work to see what's going on. And we got her TPO and thyroid globulin antibodies. Her TPO was in the 2000s. And I immediately called her back and I was like, are you okay? How are you standing? Um, and so we put her on a protocol. We did some things. Many of the things I talked about here, and her antibodies actually improved quite a bit and stabilized. And so, again, it is possible to do this. This is not something that's impossible if you have been told you have Hashimoto's or if you never had antibody testing. These things can be done to help to preserve your thyroid tissue and hopefully keep you from having to take lifelong levothyroxine or NP thyroid. So I just wanted to say that because it is possible. And unfortunately, I am seeing more and more Hashimoto's in women, but it is something that is not the end of the world. It is treatable. So, if Hashimoto's is part of your picture and you are ready for a more complete approach, I would love for you to book a free, no pressure discovery call. My signature Finally Answered program is a 3-month root cause investigation built for women who are done leaving appointments without answers. The discovery call is free. Again, it is a real conversation and it's not a sales call, and I'm the one speaking to you. Book your discovery call. The link is in the description. Compassion Primary Care serves women across the entire state of Florida through virtual care with home visits and in person care at the Wellness Center of Ellington in the Tampa Bay Suncoast region. This is not your 20s. This is not your new normal. And you do not have to prove that you are struggling to be taken seriously here. I'm Stasha-Gae Roberts. Thank you for taking the time to view this video and for trusting me with your time. Please like and share with another lady that you know needs to hear this. And I look forward to assisting you in nursing your journey to lasting wellness. Take care.